Morning, Kayla. So, as we sort of spoke about previously, you sort of come to me with the idea of beginning an exercise program to facilitate your goals in the future. So what we can sort of start with here is a pre-assessment tool, which gives me an idea of any issues or sort of health factors that might be contributing to certain things in your life. History of exercise as well, which gives me a fair idea of the type of performance you might have participated in the past and how that could influence the sort of training program ahead. Also a posture assessment as well to sort of get an idea of how your body looks before we even jump into exercise, and maybe any differentials within sides of the body that could affect the program ahead as well. So what this does is pretty much give me an idea of how you want to train, how you'd like to be trained, how we can train sort of moving forward, and it sets me up to, one, avoid injury in the future. We don't want you getting injured with the program ahead. And two, it just allows you to come into the program with a clear idea of what you're trying to achieve and what I'm trying to achieve as well. So just as a start, Kano, if I could get some consent for you just to have this video sort of assessed by my assessors. I might get you to sign there for me, Kane, and then we can jump into it. Sorry, mate, the thing's there. So this is, just for the assessors to view that. It won't be viewed by the public, although I don't think you care anyway. You're a good looking man, so get your face out there might be good for you, mate. Nah, just kidding. Beautiful, right, so I'm just going to flip back here, Kane, and start with this pre-exercise screening tool like I spoke about. So, a bunch of questions here that sort of help me identify current history, sort of health and fitness aspects. So I can fill this in here. Name, lately. This table's not very good. I might just move over here. Fantastic. Right, okay, so like I said, the aim here is to identify individuals with a known disease or signs or symptoms of disease. So that could potentially put you at a higher risk of health-orientated problems moving forward in the exercise. So this helps you identify that. So has your doctor ever told you that you have a heart condition or that you would suffer from a stroke? No. Have you ever experienced unexplained pains in your chest at rest or during exercise? Do you ever feel faint or have spells of dizziness during physical activity, exercise that causes you to lose balance? Fantastic. Have you ever had an asthma attack requiring you to have immediate medical attention at any time over the last 12 months? No. If you have diabetes type 1 or 2, have you had trouble controlling your blood glucose? Now, I don't think you have diabetes. No. Do you have any diagnosed muscle, bone, or joint problems that you've been told could be made worse by participating in physical activity? No. Do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise? No. So you haven't answered yes to any of those questions, which is good. Now, I'll just get you to sign there as well, okay? At the bottom. Chuck a date there as well if you can there, sir, on the 30th of the 10th. And then we can move on again, mate. So thanks for that. That's the first stage, which is good. That sort of stuff very related to stuff that I'd like to believe would not be common within a young male like yourself. So moving forward again, Kane, this is stage 2. So just put out your name there and your date of birth. I can sort of get the rest of it there, mate. Lovely, Kane. Wonderful. Now I'm just going to ask you some questions again, so I'll get you to answer as we go. So once again, this is to identify the risk factors associated with conditions that might be potentially harmful for you participating in exercise. So what's your age there, Kane? 31? Oh, good mathematics by myself there, 31. Gender, male. Now, there's no risk factor there because a risk factor would be 45 years of age and over for a male, which you're not. Now, family history of heart disease, Kane. So, anything on your father's side, his brothers or yourself?
On my father's side,
Yeah.
not that I know.
So, what about your mother's side?
My uncle has a heart condition.
Okay, so let's go relative of the mother. Now, how old's your father? Sorry, how old's your uncle?
I think he's like 53, 54.
Okay, 53, so. Now that's on your mother's side, so that's a plus 1. Male, 55 years. Plus, you probably didn't know that. Less than 55 years. Right, so that's plus 1. Okay. Do you smoke cigarettes on a daily basis or have you quit smoking in the last 6 months? Yes. So we've got a plus 1 there, Kane. Good that you're off the cigarettes, mate. That's fantastic. Describe your current physical activity exercise level. Is it sedentary, light, moderate, or vigorous? Right. Now, frequency. How many times per week are you exercising, Kane?
Well, my work is physical, so I would say 5 days.
5 days a week. Fantastic. So we're going to say frequency times a week. I'm going to put you in a moderate case of exercise level there because you do have an extensive job during the week as a gardener, or more than a gardener. But so I'm going to put that there. So 5 times a week, plus the idea of you maybe training once a week as well. We'll say 5 times a week. Let's say 120 minutes as well a day on average. Now, okay, so can you please state your height in centimetres, Kane, as close as you can?
194.
194. And how much is your weight?
About 85 kilos.
So, Kane, if you get your phone there for me, if you could just go on to Google there and get a BMI calculator up on your phone. So a BMI is a body mass index, which gives us a rough idea if we sit on the scale of the body mass index, and then can identify whether you are at risk of cardiovascular sort of diseases or other potential illness associated with a high body mass index. If you go back up there, I think it's if you click on that, if you click on that, the 130 there, you should go to 194. And then your weight would be 85, like I said. Giving us a body mass index of 22.6. Right, now, so 22.6. I would say sometimes, I think less than 20, you're not at risk. Less than 25, I'm pretty sure you're not at risk. Now, that's purely based on the fact that you are quite tall. So your body mass index, your height comparison to your weight, would, if that could be a slight sign that you were to be high in the body mass index, but that's just because you're literally a giant. So there's not much to sort of worry about there. So here we go, body mass index 30 kilograms or more, you're at the +1 risk factor. So you're not at risk there at all. So that's not one. Have you been told that you have high blood pressure, Kane? No. No. Have you been told you have high cholesterol, Kane?
No.
No. Have you been told you have high blood sugar, Kane?
No.
No. So physical activity is less than 150 minutes a week, so that's no as well. 150, so you're more than 150, so you're losing a risk factor as well, so -1. So you've got one risk factor here from your uncle's heart condition. In the last 6 months you have quit cigarettes, so that's another one there, so that's 2. You've lost one here due to your physical activity during the week, so you're back at 1 risk factor. So the total risk factors here, Kane, are 1. Moving on to the next part here, we've got, have you spent time in hospital, including day admission, for any medical condition, illness during the last 12 months, Kane? No. Are you currently taking a prescribed medication for a medical condition? No. Are you pregnant? No.
Wouldn't have thought that.
That's good. Do you have any muscle, bone, joint pain or soreness that is made worse by a particular type of activity or exercise? No. Fantastic. So all we've got there, Kane, is the one risk factor from the previous section there, which moving forward here, you've still got one risk factor, so plus one. Anything more than two risk factors, Kane, would make you a moderate risk client. Considering you've only got one, you're a low risk client. So that means for you, you can participate in vigorous activity, going off clearance from a doctor if that was necessary, which I don't think it is. So you have the potential to train as hard as you like, my friend, which is good. So we've already signed that now. What we can move on to now, Kane, is a bit of a posture assessment, which I said before sort of allows me to assess how your body is sort of structured just by you even standing there, without you even participating in movement. The next stage is based on how you would move within some certain exercises there. So what we can do now, Kane, is sort of get you to, even if you just want to stand up, I might just get you to keep yourself in line. Bless you, sir. I might just get you to sort of stand in line with the camera so the camera can still see me here as I'm assessing you, Kane. Right, yeah, that'd be fantastic. You can move that, yeah. Love that. Thank you, sir. Appreciate that. Right. So I'm just going to keep referring back to my piece of paper here, Kane, so I can go off that as well. Kane, is it possible for you to take your shirt off? Mm-hmm. So I can get a clear look at your body there. You've got the rig out. Okay, anterior. Can I get one more thing off you? Mm-hmm. Is it possible to take your socks off, Kane? Yes. Lovely. That just allows me to have a look at your toes and how your ankles sitting there as well. Right. Oh, you've done it for me already. Lovely. Beautiful. Thanks, mate. So just going off this again. Client name, Kane. Back to that is the 30th of the beautiful. Right. So I'm still in view here, Kane, which is fantastic. Looking at the anterior view. So what I need you to get, what I have to get you to do now, Kane, is literally don't even think about how you're standing and just stand how you would feel comfortable. Don't worry about how your feet land. Just think about being comfortable within your body and stay relaxed. Beautiful. Right, so the anterior view. Foot and ankle complex. Right foot. There is a bit of a toe out there. Okay. Looking at your foot for your feet, there's no pronation or supination of your ankle complex from you here on both feet. So that's fantastic. Hip complex. Now, from my assessment here, Kane, what I can see is that your right hip here is a bit lower than the left one. So there is a bit of an asymmetry there on the right hip. Thoracic spine, there's no shoulder deviation. Oh, hold on a minute. So okay, it seems that your right shoulder is a bit higher than your left one as well. So deviation of the right shoulder. Your head tilt, there's no head tilt there. No deviation of the hands or window deviation as well. Now, if I could get you to turn around, Kane. Okay. Yep. Thanks very much, man. Lovely. Posterior view, foot and ankle complex again. No ankle eversion there or inversion. So your ankles aren't bowing out or in, they're sort of straight both sides as well, which is good. Your knees aren't bowing in. Or knock knees, there's no bow in your legs, Eddie, which is good. Yeah, crest symmetry. Okay, so what I'm seeing again, Kane, is your right hip is definitely a lot lower. So you do have a deviation of your hip laterally on the right side there. So your right hip's definitely lower than your left one. Now, it doesn't seem like there's any scoliosis in your spine. Your spine seems quite neutral. It's running straight down the middle of your back. There's no curve in your spine there which could promote scoliosis. Your scapulars are not winging. And there is a very minute deviation of your right shoulder. Very minute. So we're going to put that down as well, Kane. Lateral view. So what I'll get you to do now, Kane, is turn to the side. Whichever way you want to turn first. You can. Beautiful, mate. Lovely. So this lateral view allows me to get a better look of the lateral part of your body as well. So now, foot and ankle complex. Both of them. Now, there is a slight bit of a plantar flexion, Kane. For your ankle is slightly pointing up a little bit. Okay, so it's only on the right foot as well. Both the feet. Okay, so there's a bit of dorsiflexion actually on both of them, which is the ankle pointing up. Yep, that's right. There. Kane, is it possible to get? Can you roll your sort of pants up past your knee there for 1 second, if that's possible, just so I can get a look at your knees and how they're performing as they're stationary there. Okay, so there's no excessive flex of your knees. They're not hyperextended and they're not overflexed either. They're quite neutral, so that's good. Looking at your hip complex, Kane. There's definitely no. Oh no, you can keep your arms in. Like I sort of said at the start, that it allows your body to remain relaxed within the position there. So there's no lordosis of your spine. You do not have flat back, that's for sure. There's no flat lumbar spine. No anterior tilt of your pelvis, so you're not necessarily like tilting your pelvis forward. There's no anterior tilt, and there's no posterior tilt either. Your pelvis is very neutral from the lateral view, Kane. In terms of your thoracic spine, so your upper spine, there's no kyphosis. Oh, no, there's not. No, there's no flat back there. There's no trunk rotation, so you're not leaning forward or back or to the side either. There's no rounded shoulders. What you do have, Kane, is a slight head forward, so forward head slightly. Now whether or not that's the right side, okay, so if you'd like to turn around, Kane, now to the other side, so I can have a look at the lateral view from the opposite side. Okay, so once again, Kane, there is a slight dorsiflexion of both the ankles. There's no excessiveness of flexed knees or hyperextension of the legs. Hip complex. There's no lordosis at the back. There's no flat lumbar spine. The pelvis is neither anteriorly or posteriorly tilted, which is good. Great sign. Okay, so the only thing, once again, Kane, you sort of do, if I was looking at a lateral line from your ankle, the center of your knee, to your hips, to your shoulder, to your head is slightly tilted forward. Slightly, very slightly. So I'm going to put that down again on the left side. Usually with a forward head, Kane, what is promoted is a kyphosis of the back. So you get your head forward, which pops your thoracic spine up, but you don't have that. So you just got a slight head forward there. So that's good, man. Right, fantastic. Thank you, Kane. Moving on to the next section here, Kane, I have included in the posture assessment as well, is just some movements that allow me to assess how your body functions through certain sort of everyday movements. The first one, Kane, is just a sagittal step. So it's not necessarily a lunge. You're just stepping forward. So it's an anterior step. So what I'll get you to do is you choose whatever foot you want to go with first and complete that sagittal step. Once we get through the whole right side, we'll go to the, or the left side, we'll move on to the other side. So you just choose whatever side you want to go with first, okay? Beautiful, lovely. So left foot forward, that's it. Whoop. Okay, so what I'll get you to do, Kane, is just keep doing that step and I can assess how the body moves through there. Okay, Kane. So there's no medial deviation of that right knee there. Your knee's not swaying either side as you step forward there. There's no medial deviation of the hip there either, Kane. There's no toe out there with the stance foot. Pronation of placing foot. Okay, so there's no, as you're stepping forward there, Kane, there's no pronation of your foot. Your foot's not turning either side. I'm promoting pronation of the foot there. I think keep going with that same foot there, Kane. Just going to have a look at the side view here, side view. Which I'll go from this side again, sorry. So heel lifting on the stance foot. Slightly. Okay, right, so this is the left side. So heel lifting on stance foot. Bang. Heel lifting on placing foot. That is not happening. Poor control of the tibia on the front foot. You've got fantastic control of the tibia there, Kane. Lovely. Poor control of the tibia on the stance foot. Nah, beautiful as well. Now, excessive flexion of the trunk. How is your trunk? Nah, beautiful. As you're taking that step, Kane, you're not flexing your trunk. So that shows good strength throughout the hips there as well. Okay. So the same thing now, Kane, but with the opposite foot. So right foot forward. Beautiful. Okay, so there's very okay, there's a little bit of deviation there of the knee cane on the right side. Very small. Deviation of the hip. No deviation of the hip, which is good. Stance foot toe out. No, the toes are out, that's fine. Pronation of the front foot. Okay, so your foot's not bending, that's fantastic. And I'm going to switch that side view. Keep going there, Kane. Fantastic, brother. Heel lifting on the stance foot, which is very common. Your heel's not lifting on the placing foot, which is good. No, there's good control there of the tibia on the placing foot. Now your tibia on the back foot there is well controlled as well, the stance foot. That's fine. Flexion of the trunk. Once again, Kane, your trunk's not flexing as you do that movement as well, so that's good, man. Nice. Moving on to the next movement here, Kane, is a lateral step or a lunge. So this one is a bit further. This one does sort of become a lunge, so I'm not expecting you to lunge the whole way down, like a complete lateral lunge. Just a lateral step and a slight lunge. So what you're sort of aiming for there is that stance or the balancing foot to be straight and perpendicular with the blind. Line of line. Alright, so front view. Okay. Go for it, Kana. Whatever one you want to do first. Alright, so your knees stacking over the foot well there, so it's definitely not stacking. Your hip stacking over the foot. No, your hip stacking over the foot well. Your head stacking over the foot well. Front view of the trunk. Right, so your trunk. There's no flexion of the trunk forwards, so anteriorly or posteriorly. You're not tilting forward or backwards. There's no lateral flexion really of the trunk, Kane. So as you're taking that step, you're not flexing the trunk with that laterally, which is good. Lateral border of the foot off the ground on the stance leg, slightly. Okay, so that's the right foot. So as you're doing that step there, your lateral border of the foot's just coming up, which is not a bad thing. Okay, Kane. If you'd like to now swap to the other side. Stepping leg. Now the knee stacking over the foot, fine. Is the hip stacking over the foot? Fine. Your head stacking over the foot well, which is good. Control the whole body. Now, flexion of the trunk again, Kane. Nope. Lateral flexion of the trunk, Kane. Not at all. Once again, you've just got that lateral border of the foot off the ground as you promote the step. Now, that's sort of happens to anyone. Sort of happens to me as well. The foot will come up a little bit, which is normal. That's fine. Okay, cool. So the last movement here, Kane, I was going to demonstrate this one. If you'd like to perform the exercise this way, now this just allows me to have a look at your thoracic spine as you promote a transverse movement. as we look at your thoracic spine and see the scapular movement throughout the top part of your body as you participate in a transverse sort of action as well. So, once again, Cam, it's just what you're sort of aiming for here is to transversely reach and grab something down there. So if you just do that one there, I'll get a good look at your thoracic spine and how that moves. Certainly. Even if you want to turn around the other way, Kane, then you can sort of step backwards. Oh, sorry, if you sort of stand here, Kane, which and then you're going, okay, like that. Thanks very much, Kane. Love that. Lovely. Right. So the scap here, there's no segmented movement. Fantastic. That's a very fluid motion. There's no segments to it at all, Kane. Spine. So with this one, you want your spine to laterally flex, and it's doing that well. It's flexing very well there. Now, some people in this movement, their whole trunk's going to rotate around with them. Yours is not doing that, which says that you've got good strength in your core and your back there, as well as your hips and your thoracic spine. It's all moving well together. Now, without me even saying, your head is following your hand, which is good. I'm not telling you to move your head with your hand, it's just doing it by itself, which is fantastic. And there's no segments to that as well. Your head is moving fluently with your hand as you rotate transversely there. Whoa, love that! Love it! And your stance leg is straight as you're performing this. So as you're doing it, your stance leg is very strong and straight there as well, which is good, Kane. Beautiful. Now, if you'd like to swap to the other side, Kane, I've seen that your right scap and thoracic spine moves very well in that motion. Lovely. Once again, the scapular region moving well. There's no segments to it. Beautiful. There's no poor flexion there of the trunk, of the spine, sorry, throughout the motion. And there's no excessive rotation of the trunk there, so you're not full bending over laterally as you turn through that motion as well, Kane, which is good. Once again, without me telling you, your head is following your hand very well, and there's no segment to the movement, Kane. It's very fluent. As well, again, as your stance leg being very straight throughout that movement as well, Kane. So that promotes. So you've got good control from the peroneals the whole way up. From the bottom of your foot, the whole way up, you've got good strength there, Kane. So that's fantastic. All the way to your thoracic spine. Lovely, Kane. Wonderful, man. Thanks very much. Right, so that one's done as well. I'll get you, there's your name, Kane, once again. Lovely, Kane. So the following part, the last sort of section that we have here is a program design questionnaire. So what this part will now allow me to do is get some information about how you potentially trained in the past, how you like to train, how you want to train moving forward, what goals are, what you're trying to achieve, and how I can help you achieve those goals. Otherwise, I'm not really paying you much attention. It's all about you. I want you to get the best out of this scenario as you possibly can. So, right, once again, your name's Kane. We've identified that. I'll put that stuff in later. So, Kane, what are your expectations of the time that you'll spend with me?
I'd like to improve my overall.
So what outcomes do you want from your exercise program? So once again, so maybe I'm going to ask you the same question again, Kane, see if you come up with a different answer. Maybe it's the same one, that's fine. What outcomes do you want from your exercise program?
I'd like to improve my strength training.
Love that. Improvements in strength training, strength and aerobic training. That's great. Good to look at the whole thing as a whole as well. Some people just want to improve strength training, some are predominantly aerobic. It's good that you have that idea and the goal of wanting both. Improvements in strength and aerobic training. What is the single most important goal you achieve with your exercise program, Kane?
improvement in overall.
Yep. Overall, oh, nice. In what time frame do you expect to achieve your goals, Kane?
3.
Lovely. Aside from your time at the gym, so that whether that's with me or with yourself, how much additional time per day are you willing to engage in activities that helps you to get to your goal, such as daily walks, using the stairs, or exercises at home?
4
Lovely. So say that it takes 30 minutes a day, Kane, of vigorous activity, so 60 is fantastic, mate. Are all aspects of your training completely up to you, or is there someone or something else that's a consideration when you schedule these training sessions?
Just myself.
All up to you. Love that, buddy. All up to me. So, I'd imagine here that the goal would be to just improve health and injury recovery, wellness. Bit of wellness here, Kane, which is good. Lovely. Moving forward to the next one, get some questions here as well. So yeah, Kane, these questions here help me to identify the style of training that you'd like to participate in. So is it more important for you to continually be active or stationary during your workouts, or both?
I think
Lovely. When you need to reduce stress, do you ideally enjoy activities to be physical, to be exciting, adventurous, competitive, or social to be relaxed, stationary, and practical? Both. Nice. Do you enjoy exercise more when it involves a repetitive routine or one that offers variety? Lovely. Does your occupation require continual moving hands-on work? There you go. So I would say that's the dominant style there. Well, let's see, because you've got a bit of everything, which is good, because that sort of promotes a hybrid style of movement, which will be good for your training moving forward, I'd imagine. Would you say that your work is sedentary, active, or physically strenuous? Active. What hobbies do you enjoy? Inactive, active? Maybe give me an example from each, Kane. What's an inactive activity that you enjoy? Fantastic. And give me an active activity that you sort of enjoy, an active hobby that you enjoy, Kane. Two very good hobbies to have, two that sort of work well with each other as well. Do you regularly participate in recreational activities? Name them if you do.
No.
Okay. Looking to change that though, Kane, which is good. So, how often daily, weekly? Well, so for instance, lately, has there been, let's just look at the past 3 months. In the last 3 months, have there been recreational activities?
Yes.
Probably, let's say, fortnightly? Yeah, okay, right, so. Let's say fortnightly, that's good. Yep.
Yep.
Lovely. Are you currently exercising in a gym or outdoor PT sessions? Yeah. So the appropriate level there would be 8, I dare say. Come back that in the time afterwards, which we can identify afterwards. Now, this last part here, Karen, is directly related to the motivation about the goal. So going back towards your goal before of improving your overall fitness, and specifically improvements in overall health. Why is this goal most important for you right now?
Just to have a more well-rounded
you don't make these changes and stay the way you are, or regress in health and fitness, how would that affect your life, Kane? What consequences could occur?
Trajectory, physical and mental health.
Love that, love that. Yeah, it's good that you're aware of your mental health as well, as well as your physical health. Downward spiral of mental and physical health. What's the consequence that could occur then, Kane? Potentially maybe becoming ill?
Yes.
All right. When you do successfully reach that goal of improvements in your overall health, what ways will life be different?
Feel much more vibrant.
So more energy and stuff, more vibrant, feel much more vibrant, energized. You might feel motivated in other aspects of your life. Yep. That's good. Love that. What benefits are most important to you, Kane, from that overall health improvement? What are the most important benefits? Better energy levels, more concentration at work, that sort of stuff.
Yeah. Most important is definitely an improvement in mental health.
Lovely. Improvement in mental health. Love that. On a scale of 1 to 10, how important is it to you to make these changes right now?
Very.
10. Love that. Why is it not a 2 or a 3?
Because I'm very motivated.
What would make it a high number? I don't think that's very possible.
What would make it a high
I
number?
don't think that's possible.
Absolutely not.
Very motivated. Go for it, man. Very motivated. Very motivated. Could be more important. All right. Do you believe that you can make these changes, Kane?
Absolutely.
Absolutely. Love that. Love that. On a scale of 1 to 10, how confident are you, Kane?
Very confident.
Hey, so 10?
Yeah.
10. Very confident. What would make your confidence a high number? Once again, probably pretty impossible.
No.
Impossible. Maxed out already. Maxed out with confidence. Are you ready and willing to change at this time?
Absolutely.
In what ways do you believe I can help you, Kane?
With your knowledge and your motivation skills.
Love that. Knowledge and motivation skills. Love that. I feel like I'm a pretty motivating guy. That's what I'm here for. Lovely. Cool. So, what I've got now, Kane, is information to come up with the goal that you've got there, your training style on your level, which I can then incorporate into the program design. So with all the information you've given me here, I can then construct a program that's suited for you, for your goal, the way you like to train, your level of fitness, and I can set up a thing that's going to be adequate for you to move into the exercise program with credentials that will meet all the things you've outlined in the previous program design questionnaire. So thanks very much for today, Kane. I'll get back to you quite soon with the program, and then moving forward we can participate in the program. If anything needs to be changed and stuff at the time, we can do that as we move forward. But this has been great today. It's good to sort of outline how you trained in the past, what your goals are, what you want to do moving forward. The best part, what I've got from all this, Kane, for me, is the fact that you're ready to train. There's no risk factors here that would stop you from training vigorously. It seems like you are pretty keen to train. What I've also got here as well is a good posture assessment. So what I can outline through this, with that slight deviation in hips and stuff, it allows me to know moving forward in the program design sort of template and how we'll go moving forward. It allows me to identify what parts of your body we need to open up prior to training with the self-manufacture release. And then afterwards, after that, your body's sort of set up for exercise, we can move into it safely. With this stuff here, with this information I've gathered, with that slight hip deviation, the shoulder deviation, if I was to throw you straight into a workout and straight to a barbell overhead press and your shoulder wasn't warmed up properly, I think we know what's going to happen. So this is giving me information to set you up correctly in the exercises moving forward, so you can participate in these and not injure yourself, Kane. So that's good, man. So like I said, thanks very much for today. Looking forward to moving forward. Good on you, mate.
Thanks, Morris.
Thanks, Kano. Woo! There we go.